One of the reasons that I went into urology was to try to help people with quality of life. And one of the fields within urology that I absolutely was fascinated was men's health, was the field of sexual dysfunction, male fertility, and testosterone therapy and low testosterone was affecting both couples that were trying to have kids and was affecting elderly men who had problems with libido and sexual dysfunction. So it was sort of a common theme to both groups of patients. And I trained at Cornell for residency, and then I went to Baylor to do a 2-year fellowship, especially in male reproduction. And then I joined the University of Miami. And ever since then, I haven't looked back. Truly an enjoyable ride so far, and I look forward to helping more and more patients and couples with these issues.
Amazing. And it's great that your focus is quality of life, right? Because that's an area that a lot of, I think, practitioners have lost. And focusing on a person's, it's not just about the numbers, it's about how this affects their everyday life. So it's amazing to see a practitioner that still holds to it.
Absolutely.